Welcome, ladies and gentlemen, to this episode of the BioSlife franchise product training call. My name is Dr. Peter Verdegam. I'm the Chief Scientific Officer of Unicity International. And on this episode of the BioSlife franchise product training call, we will cover the benefits that BioSlife has for people with diabetes and people with impaired glucose control. On the last episode, I covered the real nuts and bolts of BioSlife. What are the ingredients? What are the working mechanisms? And I gave you an overview of the clinical work that we have done, mainly in the area of cholesterol maintenance. Today's focus, as I already said, is on diabetes, and particularly people that already have full-blown diabetes or people that are in a pre-diabetic state that have impaired glucose control. Many people in our society suffer from diabetes. That's a very common knowledge. We have millions of people that currently have either type 1 or type 2 diabetes, and sadly, we have millions of people that do not know they have diabetes today because it is a disease that is in fact easily discovered, but not many people pay attention to the symptoms or are simply unaware of the fact that they already have symptoms of prediabetes or full-blown diabetes. It's really, truly an epidemic in our society. Diabetes has serious complications, and we will hear about this later in this call. And what diabetics have to do every day is keeping their glucose values under control, because high glucose values in the blood for a long period over time can result in these serious diabetic complications. And that's why diabetics are facing the daily challenge of maintaining balanced, healthy glucose levels. And some diabetic patients have to use insulin for this. Insulin, of course, is the hormone which is produced by the pancreas that controls glucose levels in the blood. Other people can control their glucose levels with pharmaceutical intervention, medication. But what it comes down to is that they are constantly having to control the amount of food they eat, the amount of carbohydrates or sugar that they eat, and have to balance that with the intake of medication or using insulin. Glucose comes from carbohydrates. Carbohydrates is the chemical name for sugar molecules that can occur in different types in our food. It can occur as plain sugar, refined sugar, but also ingredients like starch are basically carbohydrates, and our body digests starch into smaller sugar molecules. Some foods that actually contain a lot of carbohydrates are breads, pasta, pastries, and also fruits, and of course the juices of those fruits. And depending on the type of glucose, you can have either fast or slow absorption, and that makes a great big difference for the effect certain foods have on the balancing of glucose for diabetics. A term that describes the effect carbohydrates have on the glucose in the blood of people is glycemic index. The glycemic index of food determines how much carbohydrates are being absorbed from a particular food and also how fast. The point of reference for the glycemic index is glucose itself. Glucose itself has a glycemic index of 100. And other foods are simply compared to glucose. What we practically do if we measure the glycemic index of a certain type of food is we take people, we give them a certain amount of glucose and observe how fast and how high the glucose levels will be in the blood of those people. Then on another day, we give them the same amount of carbohydrates, but in a different type of food, for example, pasta. And then observe the same thing, how much glucose is getting into the blood and how fast. And when we divide those two results on each other, we get the glycemic index of that particular food. For pasta, for example, the glycemic index is about 40. But other foods like white bread have a lot higher glycemic index. The lower the glycemic index of the food, the lower is the fluctuation you're going to have of glucose in the blood. And that's very healthy because our body really doesn't like extremes. High glucose means that you will have a fast insulin response. Your body doesn't like high glucose, so it quickly excretes a lot of insulin. And this is very unhealthy for you because if you have high insulin in your blood, your glucose is going to race down very fast to possibly too low values. And if this happens, you're going to develop a great urge to eat, to fast eat. And people are overeating when they have a very low glucose value in their blood. So basically, when we don't control the carbohydrate intake in our blood, we have a strong fluctuating glucose levels in our blood, and that can result in very unhealthy situation, particularly for diabetics, but also for people that do not have diabetes right now. So how does BioSlife really intervene with the glucose values in the blood of diabetics? Well, first of all, BioSlife is a fiber product. It is very high in fiber, and most of us simply do not get enough fiber in their food. Fiber, as I explained last time, in last episode of the call, forms a gel in the body because it reacts with the acidic environment in the stomach. Slowly, a gel matrix is formed, and because you take BioSlife before your meal, you're going to have this gel matrix present in your intestinal tract when the food is coming in. And that has two effects on carbohydrates. One, the total amount of carbohydrates is actually being reduced, and that's a very great positive benefit for people with diabetes. But on the second hand, what we also know is that fiber can reduce the glycemic index of the food that we eat. So that means that if we take BioSlife before a meal, the glycemic index of white bread will actually be reduced when you take BioSlife before your meal. And this serves as another great benefit that BioSlife has on people with diabetes. And that is why if you take BioSlife before your food, your glucose in your blood is going to be better balanced and the total amount is going to be reduced. And that has a direct effect on diabetics because they can see this on their daily measurements of glucose. And typically, when they take BioSlife, they're able to reduce their medicine, such as insulin or glucophage, two of the most commonly used pharmaceuticals for people with diabetes. And this reduced glucose in their blood will actually reduce the A1C levels. And as we will hear later from our guests on this call, A1C is a very important parameter in determining the overall health of diabetic patients. And it has a direct relationship with complications that may arise due to diabetes. Now, let me discuss today some proof that we have obtained of the statements I've just made. You know that at Unicity, we spend a lot of research dollars on doing clinical trials. Clinical trials is very important to show the true effects of a product like BioSlife. And today, I have two guests on my call who have performed with us a clinical study with BioSlife in a group of people with diabetes. The guest on this call today is Dr. Isabel Martinez, who is a family practitioner and also medical director of clinical research of South Texas, in Katy, Texas, which is actually just outside Houston. And the other guest on my call today is Bobby Horn. She is the research administrator of clinical researchers of South Texas. Ladies, welcome to this call.
Thank you, Peter.
Welcome.
Well, today we will be discussing the trial that you have performed with BioSlife in the group of diabetics. But before we do that, I'd like to discuss with you a little bit about the details of diabetes. Dr. Martinez, can you explain to us how serious diabetes is today?
Well, Peter, actually diabetes is becoming quite an epidemic both in the U.S. as well as worldwide. The problem with it is not only that it's increasing and obesity is increasing, which is a direct impact on, as I'm going to tell you later, on type 2 diabetes. But 7% of the population is known or estimated to have diabetes at this time. 2/3 of the diabetics are known, but the shocking part is that at about 6 million people are out there not knowing that they have diabetes. So, as I said before, with the increasing incidence of obesity, we have an increasing amount of pre-diabetics, and it's estimated that about 18% of the population are diabetic, pre-diabetics.
Now, when you say so many people do not know that they have diabetes today, how can it be? Why is it so difficult for people to realize that they have diabetes?
I think the problem is twofold. I think that there are people that are not getting adequately treated. There are people that are not going to their health care provider, and some of them are just ignoring the signs. So I think it's multifactorial, and the most important thing is that there are certain subgroups that this is affecting more so than others, particularly the subgroups of Afro-Americans, Latinos, and Asians, which are the fastest growing pre-diabetic or diabetics at this time.
And when you say, Dr. Martinez, that people are not recognizing the signs, what are some of the signs that people have to recognize?
Well, with the increased numbers of obese individuals, and that is people that have a BMI over 25, and the increased number of morbid obesity that is going on through the world, the signs and symptoms are usually, particularly with type 2, are very gradual. Fatigue, when it becomes very, very out of control, then you will have weight loss. There is an increased amount of thirst. There is an increased amount of urination. But those are all late effects. So at the beginning, you rarely have any signs of evidence. It's a very silent and gradual disease, particularly type 2.
Okay, so that means it's even more serious than I thought, because that means, yes, there are some signs that you have diabetes, but those are very late in the process. And basically, those signs, you notice those signs when it's already too late. Is that what you're saying?
That is correct.
Okay, well, you already mentioned type 2 diabetes, so there are in fact two types of diabetes, type 1 and type 2. Can you enlighten us on the difference?
Absolutely. Type 1, which has also been designated as insulin-dependent diabetes or juvenile diabetes, it's a very specific type of insult to the pancreas, which is the gland or organ that makes insulin. Usually it's a direct insult to the pancreas, and it causes the pancreas to stop producing insulin, period. There is no insulin. Usually this happens as a result of perhaps a viral illness, but it is definitely the type that requires insulin in order to be treated. So this happens mostly in young individuals, and it is required that you have insulin on board and as far as medications. Type 2, on the other hand, is a more gradual onset. It is associated with obesity. It is also familial, so that if you have a family member, a first-degree family member that has diabetes, you run, in different studies, you run about a third chance, 1 in 3, that you will be a diabetic as well. The problem here is that the insulin is there, but it's become ineffective. Either the cells are not sensitive enough to the insulin, but gradually, with time, the pancreas itself stops and slowly decreases the amount of insulin that it makes.
So thank you. Those are the clear explanation of the two types of diabetes. But basically, as I understand it, whether you have type 1 or type 2, I mean, it's a different origin, different biochemical reason, but the effect is the same, which is high glucose in your blood, right?
That is correct. Whether it happens drastically, like in type 1, where everything stops and shuts down, or type 2, which is a more gradual and is associated more so with obesity than type 1, the end result is the same. You cannot utilize sugar. The cell cannot influx or take in the glucose, and which is the major metabolic chemical for cell life, if you will, and therefore the complications due to this inability of the cell to bring in the glucose.
So, because the glucose level is high in both type of patients, does that mean that the lifestyle choices they have to make or their eating habits are the same? Is that the same for both type of patients?
For both type of patients, absolutely yes. The difference lies in the fact that type 2 is correlated with obesity and therefore is more responsive to the changes in lifestyle. And that obviously is weight reduction, increase in exercise, and eating the appropriate amount of carbohydrates as it compares to proteins and fats.
Would you say, Dr. Martinez, that in your own practice you've seen a difference over time in certainly the amount of patients, I guess, that you're seeing on a daily basis, but also in the difference between type 1 and type 2? Is it one of the two clearly on the rise?
First of all, 95% of diabetics are type 2. So it is very rare these days to see a type 1 diabetic. And most of them, of course, have been diabetic since very early in age. And my being a family practitioner, I usually do not see them. I have a few, but they're really taken care of by the specialists. They require more intensive care. But the number of people that I have seen in my practice that have developed type 2, it's become, again, a major epidemic. And the other thing that is happening as we speak and becoming more of an epidemic is a new type of diabetic, which is the obese child that has type 2, which I have been in practice quite a number of years. I had never seen except for the last 5 years or so. There's a new emergence of a type 2 juvenile diabetic.
Wow, that's very scary. I mean, it's not only a disease of the elderly, but it's getting to our younger population faster and faster, right?
That is correct.
Now, if people have diabetes and have not been able to control their sugar as they should have done, what are some of the problems? What are some of the complications that can arise because of diabetes?
Well, Peter, the first thing that happens is that if you are diagnosed with diabetes, you automatically, as far as heart disease, are considered one step up in risk. So if you take two individuals that have the same factors, and one is a diabetic and the other one is a non-diabetic, you are automatically up one step higher as far as risks. So it increases your risk of heart disease and stroke. It directly increases your risk of kidney disease. As a matter of fact, diabetes is the single most important problem or risk for people that are on dialysis units. It increases the number of eye complications and blindness, as well as nerve damage. So it affects all the body systems.
Wow, that's very serious. And it's interesting that you say that having diabetes means that you're already one step up the ladder for getting cardiovascular disease, such as heart disease and stroke, because that gives us another strong argument why BioSlife is the product for diabetics. Well, thank you, Dr. Martinez, for this introduction on diabetes. Right now, let's go to the study. We at Unicity knew, of course, by long-term users of BioSlife that it has interesting effects on glucose management. But having anecdotal information is great, but of course what we want to have is good clinical studies that actually prove the effect in a group of people. So that's why we have contracted with Bobby Horn and Dr. Isabel Martinez to perform this study for us. Bobby, can you explain us to the audience how this study was organized? What type of patients did we include? How often did they use the product, and how long was the trial?
Certainly. First off, let's talk about study design. We had the obligation to observe the efficacy of BioSlife Complete on the glucose control and lipid levels, because we wanted to measure those lipid levels only in people who were diagnosed with type 2 diabetes. We were not opening up the study to type 1 diabetics at all. This was a 12-week study. We measured hemoglobin A1C both at baseline and 12 weeks. And the reason that hemoglobin A1C was measured at 3 months was because this is a 3-month fluctuation. We want to see how much blood sugar was controlled over a 3-month period of time. It used to be that diabetics could get faithful 2 weeks before they went to the doctor and do their fasting blood glucose, and it looked pretty good. But there was no way to measure how much it fluctuated, and this is now a measurement that physicians rely on to see how much real glucose control is there. We did the lipid panel both at baseline, week 4, and week 8. Our enrollment target was 50 patients, and our first subject was enrolled May 1st of 2006. Now, normally it's very difficult to find 50 patients who can participate in a diabetes study in a short period of time. But because BioSlife does not have any contraindications, the patient group that we were looking at was very willing because they didn't see any negative side effects that would affect their participation in the study. So by the end of May, May 25th, we had 51 patients who had enrolled in this study. And we actually included one extra because we had a physician that was interested in participating, and we really wanted her to have some firsthand experience. The age group that we were primarily looking at was 18 to 75 years of age. and the youngest participant that we had was 31. The subjects were instructed to take the BioSlife Complete 3 times daily, and because of the fiber content of BioSlife Complete versus BioSlife 2, I felt pretty confident that we could instruct a patient to take it 3 times a day and it was not going to have the gastrointestinal distress that maybe people would have experienced with a higher fiber content. So this was 3 times a day, 10 to 15 minutes before their main meals. They measured their glucose values daily in a little diary. And we follow a schedule here because we like to see what the postprandial measurement is, and that's 2 hours after someone eats. So the schedule that we followed was Monday before breakfast and 2 hours after, Tuesday before lunch, 2 hours after, Wednesday before dinner and 2 hours after, so that we could capture a really good picture. Thursday before bedtime, Friday before breakfast and 2 hours after, Saturday before lunch and 2 hours after, and then Sunday before dinner and 2 hours after. Every time the patient would come in for their follow-up visit, we would review the diary and then we discuss the values and try to understand why they were higher and lower at specific times. Perhaps they had had a very high glycemic meal, and that was part of the reason. We did a little bit of glycemic index education so that there was a little bit greater understanding of carbohydrates. As you explained, Peter, not all carbohydrates are equal, and many of the patients that we had did not really understand that. I'm going to give a little perspective on some of the participants that we had in this study, because with 51 patients, the majority of those patients had been treated with pharmaceutical agents in the past. But there were 3 patients who were newly diagnosed, and it was Dr. Martinez's decision to ask them if they wanted to participate in the study rather than going on a pharmaceutical agent. So we had 3 patients who were taking BioSlife Complete only, and their results were pretty significant. I'm going to give you the overall results of the data, and then I'm going to come back to these 3 patients so that you can understand the comparison. We're going to take a look first at the 12-week measurement of hemoglobin A1C, because that was one of the major things that we wanted to look at. And we divided the data into 2 different groups so that we could see if someone had a hemoglobin A1C of greater than 8, which is really, truly uncontrolled. We really feel that anything greater than 7 is not controlled, but certainly greater than 8, it's more dramatic. In the 12 weeks that we measured this, A1C for the group that was greater than 8 saw a reduction of 15.8%, which is very dramatic for our standards. Hemoglobin A1C over the entire group, we saw a reduction of 9.4%. Now when we take a look at the values for the lipid panel, LDL, we saw for those people who had an LDL greater than 160, we saw a reduction of 28.9%. And for the overall group, we saw a reduction in LDL of 18.3%. Then we took a look at triglycerides, and truly in this group of people with type 2 diabetics, triglycerides are the measurement that when we look at it, we can really see how controlled someone is. For the entire group, we saw a reduction of 21.3%. But for those people who had triglycerides of greater than 150, we saw a 32.5% reduction, which we felt was pretty significant. The glucose levels for the entire group dropped 17.3%, and this was the measurement of glucose, fasting glucose. And the group that was greater than 175, which is a really seriously uncontrolled diabetic, we saw a reduction of 28.9%. I'm going to come back, if I can, to the patients that were on BioSlife Complete only. I'm going to give their patient number. Patient number 7 had a baseline measurement of A1C of 6.6, and this was a newly diagnosed diabetic. When measured at week 12, it was 5.9. So that's very significant with only BioSlife Complete. Patient number 21 at baseline was 6.6. At week 12 was 6.1, certainly getting much closer to control. Patient number 37 at baseline was 6.8, and measured at week 12 was within normal range at 5.5. So we thought that was very significant. when you look at the overall group of patients, obviously controlling those lipid levels was important because, as Dr. Martinez said, if you have diabetes, you have cardiovascular disease. We had one patient who participated in the study, and we knew that she was a controlled diabetic. She started with a hemoglobin A1C of 5.5 and ended with a hemoglobin A1C of 5.5. But it was interesting to see the reduction in total cholesterol for this patient from 219 at baseline to 179 at week 8, and her triglycerides dropped from 139 to 91 in that same time frame.
Wow, those are some amazing results. Thank you very much, Bobby, for covering these. Dr. Martinez, when you looked at these results, what was your first impression on the effect of BioSlife for your patients?
Well, I've used BioSlife in the practice for a great number of years, but the amazement was that results that were compared to some of the medications that we use were much better. The results were better than some of the statins, for example, and some of the medications like metformin that I use in the practice. So I was very, very, very pleased that we were able to confer what we already thought was happening to our patients.
Wow, that's a very powerful statement that you make, that you see the effects of BioSlife as in some cases even more pronounced than standard of care, which is the medications that these people use. What is normal procedure after doing a clinical study is getting the study published. Do we have any plans for that?
I am hoping that we can get the study published and shown at some of the conferences that are upcoming. So, yes.
Great. That's real validation if we publish this study result in a peer-reviewed journal, because as we say, scientists say, if you don't publish the work, it's never happened.
That's correct.
Well, I'm truly amazed and very thankful of the results we have seen in this study. We knew, of course, that BioSlife was effective for diabetics, but once you really do an independent study by critical doctors as yourself and seeing the results in their own patient groups, that is the real power of doing a study with a product like BioSlife. And if I may conclude, we've seen tremendous results. We heard Dr. Martinez say that BioSlife improve the situation of their patients, both in terms of glucose management, but also in cholesterol management, and for certain people with very impressive numbers, even better than they would have reached with normal standard of care using pharmaceutical agents. And that is a great result for our product like BioSlife, because BioSlife is not a pharmaceutical agent. BioSlife is a completely natural product which has absolutely no side effects, and it should be considered by everyone who has diabetes today to at least add to their current regimen of glucose management, because not everybody will be prepared to rely solely on BioSlife, but they don't have to. BioSlife is a food, and in that regard, everybody can take BioSlife. But it's important to realize that if you have diabetes, if you control your diabetes with pharmaceutical agents, and if you're going to start on BioSlife, adding it to your daily regimen, you're going to have a better effect on your glucose. And that typically means that the amount of medication that you need is going to be reduced. And we want to make sure that everybody who starts with BioSlife is aware of this fact, so that you should discuss this with your doctor if you have diabetes, because we want your doctor to be aware of the fact that because you're taking BioSlife, your need for medication is going to be reduced. Another important message that I would like to conclude with is that this is a study that was done in people with already existing diabetes. Of course, that's the way normally studies are done. You pick a group of people that have a certain health concern. But that doesn't mean that the product is only good for people that already have diabetes. As we heard Dr. Martinez say, there are many people out there, first of all, that don't know that they have diabetes. And second, there's a large group of people that is in the pre-diabetic state, in a state that is not yet considered to be diabetes, but have all the risk factors that will make those people to become full-blown diabetics maybe in the next 10 or 20 years or even sooner. So there is a huge group of people that really would benefit from taking BioSlife every day, regardless of the fact if they have diabetes or not. Because even if you don't have diabetes at all, the effects that we just described on blood glucose is also very beneficial for people without the disease. Because BioSlife is going to stabilize your glucose absorption. It's going to reduce the glycemic index of foods, and both effects have great positive benefits on also, for example, weight management, because we know that fast glucose changes in the blood result in, for example, big sugar cravings or the resulting eating binges. And these things can be controlled when you take BioSlife consistently before every meal you are taking. Ladies and gentlemen, I hope this was a very informative call. I think it was very informative. We learned a lot about diabetes. We learned a lot about the strong benefits BioSlife can have for people with diabetes and people without diabetes. And I'm looking forward to next week's call, where we will cover another study that was performed with BioSlife. Thank you for now, and I hope to catch you next week. Bye-bye.